Tonight.
What's the question, Crier?
Does America need compulsory health insurance?
Welcome to Historic Town Hall in New York City for another spontaneous, unrehearsed, and uncensored discussion after the pattern of the old New England town meeting.
And we're to hear from the distinguished professor of public health at Yale University, Dr. C.E.A. Winslow. Dr. Winslow.
Mr. Moderator and members of the audience, the question asked of your speakers tonight is, does America need compulsory health insurance? I should like first to be quite clear as to what we mean by America. America is the land of the free, and Columbia is the gem of the ocean. Neither land nor gems require compulsory health insurance. If the chairman will allow me to interpret America as meaning the people of the United States, I can proceed more intelligently. But even here, the terminology is far too broad for a categorical answer. There is a small section at the upper economic level of our population that does not need any change in the present situation. They can now obtain the best medical care available, and they can pay for it by the use of profits and reserves. They are essentially self-insured. There are much larger groups of people of the United States who urgently need health insurance. Sickness is not an average problem, but an emergency. In general, at any income level, it appears that in a particular year, one family out of each 100 has medical bills amounting to between 1/4 and 1/2 of its total annual income, while other families in that year have no medical costs at all. Now, the answer to such an unequal distribution of costs is entirely obvious. We deal with all the other emergencies of life, fire, theft, death, by insurance. That is, by the pooling of the financial resources of a group of people over a period of time. It's abundantly clear that the only way in which a family on the middle economic level can pay its medical bills is by the application of the same principle. Our next question concerns the adjective compulsory. And it seems reasonably clear that below the small group of the wealthy is a second group which needs some form of insurance against the emergency costs of medical care, but is sufficiently well off to purchase such service on a voluntary insurance basis. This is the group which can readily pay the average cost of medical care, but which cannot budget for the unpredictable emergencies of sickness. This group needs health insurance, but not necessarily compulsory health insurance. More than 3 million of our population now purchase voluntary insurance to cover the cost of hospital care. And through the development of such organizations as those represented in the Group Health Federation, we have even more significant results in regard to voluntary insurance covering physicians' care as well. Voluntary insurance of this sort has developed new techniques of distributing medical care which offer real hope of achieving in practice the unrealized potentialities of modern scientific medicine. And it's contributing materially to the knowledge of administrative procedure and of the cost of adequate medical care essential to future organization in this field. The problem with which voluntary insurance has had to contend has been the relatively small groups generally covered, for only with large groups representing the population at random can full stability, efficiency, and economy be assured. Furthermore, there is a third group in our population for whom no system of voluntary insurance can suffice. The families in this very considerable group cannot even pay the average cost of medical care with sufficient ease to make them potential members of voluntary groups, and many of them can only pay a part of this average cost. The economically less fortunate half of our people actually receives only less than half of the physician's care, only 3/4 of the hospital care, only 1/5 of the dental care, and only 1/10 of the special nursing care utilized and wisely utilized on a higher economic level. That is the indictment of our present lack of system. Compulsory health insurance is the means by which health service can be extended to those who can pay only a part of the full average cost of medical care through contributions to the fund by the employer and by the government. Thus, there is a considerable section of the population of the United States, primarily in its industrial areas, which needs and urgently needs compulsory health insurance. and within the general framework of our existing social order cannot obtain adequate medical care in any other way. I should like to note that no sharp line can be drawn between these various possible modes of providing medical care. Even when compulsory insurance comes, the voluntary health associations, the organizations now established providing industrial medicine, and the plans worked out by certain farm groups and the like would have a very real and vital part to play. For a considerable section of the population above the limit of a compulsory scheme, voluntary health associations would continue to meet an essential need. And any wise compulsory insurance law should provide a place for voluntary group service to its members by exempting from the working of the compulsory law those groups already provided under a voluntary plan with services equal in type, amount, period, and quality to those secured under the compulsory system. Now, finally, for the indigent in the cities and for the general population in many rural areas where the social and economic conditions necessary as a background for insurance are lacking, an organized system of medical care supported from the tax levy is the only answer. So much for America, which seems to cover at least 4 distinct groups whose needs are different. 2 of these groups need health insurance, either voluntary or compulsory, and the conditions under which sound health insurance plans may be set up deserve serious consideration. In the first place, any such plan must be economically sound and administratively safeguarded against possible exploitation. Secondly, it's highly desirable that health insurance should have as wide a range of services as possible, including certainly as a minimum physicians' care, both general practitioners and specialists, nursing care, hospital care, and necessary drugs. And last but not least, a sound insurance plan must provide the maximum attainable standards of quality. To many of us, it seems clear that the only real, practical safeguard of quality lies in the development of some form of supervised group practice. And it is in their demonstration of the values of such group practice that the voluntary health associations have rendered one of their most valuable services. There is thus no simple answer to the question that has been put to us in this discussion, nor is there, as Dr. Sigris said, any single panacea for the solution of the problems of medical care. For various sections of the population, we need the traditional system of individualistic medical care, we need voluntary insurance, we need compulsory insurance, and we need an expansion and a far better organization of tax-supported medical care for the indigent in our cities and for the population of our rural areas. We need, in other words, a broad national health program employing various procedures in the sense in which it was formulated by the conference held in Washington during the summer of 1938. Progress must be gradual and evolutionary. But if any progress at all is to be made, it is essential that federal grants should be made available to stimulate experimentation by the various states. We stand still and quarrel about details and about hypothetical damage to our vested interests, while men and women and children suffer and die for the lack of the resources of modern medical science. Let us forget slogans and avoid vague terminologies which arouse the secretion of the endocrine glands instead of stimulating the higher nerve centers. Let us recognize that the situation is serious and calls for action. Let us remember that there is no single easy solution of the problem, but that what we need is a national health program so constructed as to enable the people of these United States to obtain and to pay for the medical care they need, whether they pay for it as individuals, as groups, or as taxpayers.